guys, welcome back to Medical Coding with Blue. Today's episode is all about the 2 things that new medical coding job seekers should never pay for. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, if you are out there navigating those crazy waters of looking for your first job as a medical coder, this advice really applies to anybody that's seeking a job, right? First of all, there's a lot of people out there that will be out for themselves, okay? And we have to use common sense as job seekers when we're out there looking for a job. Now, you may be so desperate as to think, is this the way that it is? When you hear about somebody saying, well, if you pay for experience, I'll write you a letter and say that you worked for me, or I will make you work for free, and you can gain experience that way. That's basically you're paying for experience. You never do that. You never work for free. Okay, guys? Never work for free. Never pay for experience, because you have a skill as a certified medical coder. You have a credential, and it says that you have passed this competency test, whether it is from the American Health Information Management Association or the American Academy of Professional Coders. Either way, you have passed this competency test and you're out there seeking a job. You should never work for free. Do not volunteer. Oh, it's just so I can get my foot in the door. It doesn't matter. You have a highly valuable skill that you should not be giving away for free. And you should never pay for experience. I've heard about crooked businesses that do that, where they make the people pay them, and then they say, oh yes, well, we'll write you a letter that says you have this experience with us. Really? Come on. Because the thing is, there's so many other alternatives that you can go into, so many alternative jobs that you can get into if you can't find your first job in medical coding. But I'll get into that in a minute. But the thing is this. When you submit yourself to working for free and you're saying, well, it's just so that I can gain experience because I really want to work at home and I really want to do all these things. It's not about what you want yet, okay? You have not built up the time in, you have not built up that experience level to be able to make these demands. There's a lot of people coming into this industry that have those demands right away. And they want to cut corners and they want to do things to try to get their way in without doing the hard work, which is actually just applying for these jobs. And if you're telling me, well, Blue, no, I've applied to over 100 jobs and no one said anything and I always get turned down. Look at the state of your resume. The resume is going to be a big part of it, because if you don't have a good, solid resume that talks about your skills and the things that you know since you've been in the school or since you've been certified, if you're not translating those onto your resume, your little one-page resume, that's going to be a difference between yes and no. I've seen a lot of people, especially on LinkedIn, they post their resume and it's 4, 5, 6 pages, which I tell y'all not to do, but maybe they haven't heard my story yet. I tell y'all not to do that. But it's 4 or 5 pages, and then sometimes it has nothing to do on there about coding. Well, I've never worked as a job as a coder before. No, but you have the skills now. You know how to use ICD-10-CM, your diagnosis codes, your CPT, HCPCS, and for those of you who've been trained on the inpatient side, you feel comfortable enough, add ICD-10-PCS. Those are your skills. And when you look at the job listings, a lot of you are not looking at the job listings. You're not looking at what they want. And then I'll get messages that say, oh, Blue, well, what do employers want? Did you even look at the job listing? The job listing will tell you medical terminology, anatomy, pathophysiology, and all of these things that they want. And sometimes people will put everything else but that. They'll put on their leadership on their skills list. Am I hiring you to be a leader? No. You are looking for a job as a coder. You should be having things on there that are related to coding, because that is your skill. Just because you don't have experience doesn't mean that you're not skilled. Okay? So keep that in mind. So you never, ever, ever work for free, and you never pay for experience. I heard somebody say that the other night on my live. A fella came in talking about how do you have to pay for experience? No. You never ever pay for experience. And it's very infuriating to me that there's people out there that will have the gall to want to take advantage of brand new people who are just trying to start out in this industry and make them pay or make them work for free. And some people have said, well, Blue, I'm volunteering at my doctor's office, and they said that, they'll let me code. And that's just sickening to me, because a doctor's office has money. And if they don't have money, it's because they are not managing their funds well. And that's not a place that you want to be at either. I always tell y'all to apply with the hospitals in your local area. Sometimes the hospitals will have people working at home. Other times they'll do like a hybrid situation. But a lot of times, if you are putting up those barriers of, well, no, I only want to work at home, that's a lot of your problem right there. Because if you're not allowing yourself to get in house for a little bit and get experience being around other medical coders, you are going to be missing out on a lot. And I will always stand behind that, because book coding and real world coding are two different things. Book coding doesn't mean that you can't do real world coding, obviously. But what it does mean is that it's a big difference sometimes, especially with these providers and how they want to document. So again, if you're taking the time and going into the facility, you will be good, because that way you can be around people to be able to ask questions and get that camaraderie going, okay? But don't do this for free. And a lot of people will either complain that the pay is too low, the starting pay is too low. I'm going to talk about pay, but not in actual dollars, in another video. But the thing that I want to say about that is this. You are not going to start out at the high end of the scale. You all need to have some kind of reality when you're thinking about how much you're going to get. The Department of Labor and the Bureau of Statistics have the listings for the amount of money that medical coders get paid in your area, because every place is going to start coders at a different rate. And not only that, if it's a state hospital or if it is a federally run hospital, if it is a private hospital, everybody pays a different rate, okay? And people get so upset with me because I don't give actual figures. That's not my channel. I've never done that, and I will never do that. I encourage you all to do your research. But again, you don't want to work for free, all right? And do not work for free, because these skills that you have are very valuable. And when people do that, when people contribute to working for free and then people get used to that, it cheapens the field. Do not do that. Do not be a part of that chorus and that bunch of people that are doing that because they're so desperate trying to get in, okay? You have to think strategically when you're out there. Okay, so again, if you are out there and you're applying and they're telling you no, look at your resume. All right, that's your first stop, is look at your resume. If your resume is more than one page, it's already bad. Okay, you need to have it on one page. You need to have all the things that I've said. Look at my videos to go over those things. Okay, so there's a lot of information out there. You have to be able to help yourself, guys, because people will not help you. Okay, and I give a lot of really good information on my channel, but a lot of times people want things spoon-fed to them. And this is not the industry for that. And especially those people who try to do, those little shortcuts to try to get in by working for free, or, the other thing is that you never do is pay somebody to find you a job. The same fella that was in the live was asking about that. If you have to pay somebody to get you a job, you never pay for somebody to get you a job, not even a headhunter. You never, ever pay for a job, because if you are out there looking and you're actively applying and putting your resume out, and a good resume, because that resume is going to be your talking piece when you're not there. It's got to be good enough to be able to grab their attention, okay? But when you're out there and you go to these headhunters and you're trying to pay them to, get you to find a job or whatever, that money could have been spent on getting your resume improved, or you actually getting out there and seeing what's out there. Because even though, yes, that's what they do, that's their job, it's not going to guarantee you that you're going to find a job as a coder, okay? Because again, we have specific requirements. And I've always told people that another option for you to do and to go to is your local area. A lot of them have temporary agencies Now, if you Google temporary agencies for medical professionals, because no, there is not a national brand that I recommend, because really there isn't a national brand for temporary agencies for medical professionals. There's ones, but they're usually like in a certain area and they're kind of big, but there's no national brand. So I can't name a national brand, but you can always Google. And if you Google temporary agencies for medical professionals, you will see the ones that, you know, come up with that kind of thing pop up in the Google search, right? And then you will be able to see what kind of jobs do they have. Sometimes they have jobs for billers. Sometimes they have jobs for coders. That was how I got my first job as a medical coder, was going through the temporary agency. And I said the same thing too. I said, oh no, I don't want a temporary job. I want a real job because I know everything, right? I don't. And I didn't at the time, you know? So they said, well, all the experience that you get working as a coder, if you're working temporary jobs here and there, that's going to get you that experience to be able to get you in. And it's going to fill out your resume, which is true. And you're going to get exposure to the electronic health record. You are going to have a lot less pressure on you as a temp employee just starting out, because they're not going to expect too much from you, okay? And sometimes these temp agencies, they get contracts for like hospitals to be able to do their coding and stuff, because sometimes the hospitals, they farm out that work to temp agencies, and the temp agency handles all the hiring and they hire all the people to do all of those things. So that's where you want to seek if you want to try to find yourself a job at a hospital. Sometimes it's through the temp agency, okay? And going through the temp agency will also get you the opportunity that if you get put with an assignment, you take their assessment test, you pass it, and they put you on an assignment. If you go there and you decide, hey, I don't like this, it wasn't a good matchup for me, that's okay. They can put you with another job. That's the great thing about working for a temp agency. And a temp agency is just temporary. It is not a long-term thing. It is not, going to be your job forever. It's just where you are starting. You have to be able to remember that, because a lot of people get stuck on that hamster wheel of, oh no, I don't want a temp job. I don't want a temp job. I need benefits. I need this. I need that. I understand. I understand that. However, you are trying to start out in a field that requires experience. They require experience because there's a lot to this. We have to know what doctors know while never having gone to medical school. I say this a lot. I say this all the time. Not because I'm trying to scare folks. It's because I'm trying to prepare people. A lot of times people don't know how to take that. They don't know how to take it. They say, well, Blue, that's just too scary and you scared me and I can't do this. Yes, you can. Wouldn't you rather know about what to expect out there and what could potentially be going on, and prepare your response rather than, oh, I don't know. And then all of a sudden you're just hit with this reality when you get out there. Come on, guys. So that's why I say, if you are going to be out there and you're going to be applying, go to the temp agency, see what they have available. You're not working right now anyway, right? And if you are working and you say, well, Blue, I have my job and I'm working right now, but I really want to transition into this. You have to make decisions, okay? You have to make decisions. No one can make this decision for you but you, all right? And again, you want to look at all of your options. If working at a temp agency is not a good option for you right now, that's okay. But you want to keep applying for these other jobs that that those are full-time jobs and they'll be able to get you in and that kind of thing. And again, if you are looking at alternative jobs to starting into trying to get your foot in the door to get into medical coding, I've said many times, do not go for like patient access or medical secretary. I've told y'all about avoiding those because they don't require you to have medical coding knowledge. You're not going to be able to use your medical coding knowledge. Where can you use your medical coding knowledge that you could easily get in much more easily than, going out there for a coding position, even though you should still apply anyway, is medical billing, obviously, because you're going to be able to see the codes. I've said that before, see the codes, and you're going to be able to understand the process of the revenue side and that kind of thing. There's also, you're working with prior authorizations. Now, prior authorizations is not coding, but you are exposed to the codes because the doctor has to give you the patient's notes and things like that and say, okay, I want to do this procedure and I want to do it on this patient who has this condition, call the insurance and see if they'll let it go through. This is getting you exposure to codes. So that way you can start to build your knowledge up, okay? And doing those things. Claims reviewer is another one. Now, claims reviewer, you're working on the insurance side, and you're going to be doing like denials and things like that. So again, that's another good way to get yourself in. There's many other alternatives to starting. But again, it's going to take you being open enough to, one, apply for these jobs even though they're asking for experience. Okay, apply for them even if they're asking for 3 to 5 years of experience. If it is a coding position, you want to go ahead and apply. Because if happy coders are in that area, they're going to stay where they're at. If that employer is really desperate, they're going to call whoever is applying. And if you applied, and if they give you an assessment test and you passed, and then they say, okay, we're going to give you a try, you just got yourself a job. Instead of being so scared and not applying, okay? So that's the thing that you have to know, guys. You have to kind of think differently from what you all are thinking, because for some of you, you're being very steadfast and stubborn, and you want things your way. You want to be able to work remotely. You want to be able to travel and do all these things, these unrealistic things. You want these unrealistic starting salaries when you haven't even done your research, okay? Medical coders get paid well. I don't talk about money and specifics on my channel, but they do get paid well. But you have to get yourself out there and start applying, and be gracious when you are out there and you are applying. These people are looking for people who are competent to do the job. Because there are so many fast-paced medical coding programs that pump out all of these coders, and sometimes they have these coders with all these credentials on their name, but they still can't code for a lot of these basic things. That's why they're a little bit more cautious. It's about business, guys. It's not personal. It is a business transaction. You have a skill. They don't know you. And when you are introducing yourself on paper, that's the only way they're going to be able to get to know you, is by paper. So you have to make yourself look good on paper. You may not have experience, but again, if you have your resume set up and you have all of your jobs that you have had, and you're talking about the things that do translate over to coding, like protecting private information, or if you had to handle money, if you're applying for a billing position, if you had to do any of those things, that's the things that can be translated and put onto your resume. So that way it'll start to pique their interest, all right? Because they need to know, what do you have? Because they know you don't have experience, but what do you have that can translate over to their organization, and how can you help them? That's the big thing. But again, do not work for free. Do not pay somebody to find you a job. You can find a job on your own, all right? And it's just going to take some time. Some people get very frustrated only applying for like 3 months, and they say, oh, I've been looking for 3 months and I can't find anything. Some people look for 9 months. Some people look for an entire year. Again, because either they're just not applying appropriately, or they are being very picky about where they're going, or they're seeking those entry-level words. I've talked about this before. When it comes to seeking a job, you cannot look for words that says entry-level in the job listing. Why? Because even though I don't have experience, we all know this. But if an employer is out there and they're hiring and they say entry-level is okay, or entry-level position or whatever, they're going to have thousands of people applying for these jobs because they saw those magical words. They don't do their research and they want to do, oh, it's entry-level. You are going to be entry-level regardless of if you applied for an entry-level position or you applied for a regular position that's asking for experience. Everybody has a ramp-up period, a period of like a probationary period that they're going to give you in order to be able to start to meet your quota and start to meet your accuracy and things like that. So everybody has time to get up to speed. Some are shorter than others, but you will be given time to get up to speed. But it's all about you being, again, proactive, not paying these people and not working for free, because you're wasting your time. And again, there's no guarantee after you've been working for free that that person is going to really write you a letter or want to let you go. Think about that. You are giving away your time, your energy for nothing. And if for some of you, you're giving away your time, your energy, and you're giving that person money. Because again, like I said, I've heard of the people that charge for internships, which is so stupid. But there's crooked people out there that do that. But people let them take advantage of them, and they fall for it. They go right for it. Well, no one wants to hire me. Again, if you're not doing all these things like I've said, and like really applying out there and looking at the job listings, and not just looking for medical coder, but also looking under different alternative job titles. All right? Because there's a lot of different titles for medical coders out there. Okay? It is not impossible to get a job when you're brand new. It is not impossible. Okay? But you have to have some patience, and you have to really look at yourself and what you are putting out there. If you are putting out a poorly written resume, you will continue to get no calls. This is very serious. When you are out there, if you do not have a properly written resume, that's a big part of it. Okay? A big part of it. And before any of you ask, yes, I do write resumes. However, I am currently booked until the end of August. I will start seeing new clients at the beginning of September. If you're interested in getting your resume written with me, or you want professional coaching or something, that will be available to start booking in August, but it will be for September appointments, okay? I will not schedule appointments before then, okay? Because I'm already booked as it is. So with that said, please do not pay for a job. Please do not work for free, because it is not worth it, and you're wasting your time. Because again, even though you have to learn their way of doing things and their electronic health record, you still have a valuable skill. Never forget that. Never forget that you have a valuable skill. And if you feel like, well, Blue, I don't feel like I'm really competent in it, I just happened to luck out and pass the exam, then you need to go back to those workbooks, or the workbooks that I have in the description box below, and you need to start practicing again. Because if you are not practicing and you're just running around essentially feeling sorry for yourself because you can't find a job, that's really on you, and you're setting yourself up to fail. Don't set yourself up to fail. Set yourself up to succeed. And how do you do that? By studying, by getting a good resume, looking at my channel with my videos about resume tips, so that way you know, okay, this is what I got to do. Look for those alternative jobs. There's other ways to do these things except for, doing all these other things that you shouldn't be doing, which is like working for free. Do not do that. And I even told the fella in big caps, do not work for free. Do not pay somebody to find you a job when you can find yourself a job. Because think about that. All that time and money that you're putting towards somebody else, you could be investing into yourself so that you can be successful in your job search. Okay? But do not give up on your job search. Sometimes it just takes a while. Okay? And if you say, well, Blue, I have bills to pay, then you'll have to do like I did, which was still continue to work while you're looking for another job. And when I tell people this now, they start to panic. Oh, no, I can't do that. I can't do that. I worked housekeeping, bartending, halfway house. I did all of these things to keep my head above water. I worked 7 days a week. There was not a single day that I had off because I was always doing something, trying to make money, trying to find my first job. But it wasn't until I listened to my mom when she said, go back to the school. And I listened when the principal told me to go to the temp agency, because trust me, I was adamant I didn't want to go to the temp agency. But as soon as I did, that was what opened the door. I had a job in a week. In a week, after I'd been looking for 2 months. I had a job in a week. And that job was for 3 months. Then from there, I had another assignment, which was 8 months that I was there. It was a 5-year assignment, but I was only there for 8 months because I wanted to get back home. And I was successful at finding my forever home job where I'm at now. And, that was after I was there for 8 months. So again, it was taking what I thought off the table and working on, okay, I'm taking this other advice, and look, and I've been here for 15 years. I did something right, and it was finally when I started listening. I'm just saying. So with that said, again, I hope you all hear my message. Find yourself a good job by doing the right thing, being patient with the search. Don't get so desperate that you start working for free, or that you start working in some job like being a secretary or being a patient access, something that's not going to use your skill. Okay, stay away from those jobs. All right, I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.